I wonder, what do you think is the greatest hurdle for therapists to make that leap and to use
Well, there's
tools?
tremendous numbers of hurdles from a practical point of view and from a philosophical point of view. From a philosophical point of view, to learn this new form of therapy, TEAM, which stands for testing, empathy, agenda setting, or paradoxical agenda setting and motivation, involves the death of the therapist's ego to really become a world-class therapist. And the ego dies on many different levels. And this is tough for therapists. For example, one simple thing is one of the empathy techniques is called, as you know, the disarming technique.
Right.
And what that means is that if you're using, say, the brief mood survey, an evaluation of therapy session, as you know, this is a data-driven therapy. We test patients at the start and end of every single therapy session, and they rate the therapist on empathy, on helpfulness, with extremely sensitive scales. And if you do this, most therapists discover that they're getting failing grades from practically every patient at every session. And that's a shock to find out patients don't see us the way we thought. And then one of the techniques is to elicit patient criticism and then to find truth in what the patient is saying. And I have to do this in the workshop. I get feedback from every person in the workshop every day. What did you like the best? What did you like the least? How did you rate the workshop? And then I read those out loud, the 10 worst criticisms and the 10 best things. And the only way to overcome these criticisms is to find truth in them, and because they are valid. When patients say, you don't care about me, you don't understand me, you're not helping me, that's true.
Yeah.
And if you agree with it in a kindly way, the patient won't believe it anymore and it won't be true anymore. But that involves the death of your ego, because you have to agree that you are in fact failing the patient in those ways. And that's very painful for therapists at first, because we all have pride and pride gets in the way.
And we kind of need to do it again and again, and kind of our ego comes up again, and then we have to kill it once
Oh
more.
yeah, we drift in and out of enlightenment. Once you've had this joyous enlightenment experience, you feel just so wonderful. This can go on forever. I feel so close to people. I'm not threatened by criticism. Everything is right. And then 2 or 3 hours, you're back to your irritable, ornery self again. But that's just one example of what's challenging. Using the rating scales is very challenging for therapists, because they're not used to doing this, and it's on and on and on. It's very challenging to learn this new model of therapy, but the rewards too can be very great. But it is not easy.
My experience with your work is that you lay it out so clearly, and there's something so crisp and clear with the way that you lay it out, and then it feels, oh yeah, I can totally do that. Of course, this makes a lot of sense. I've been doing that for years. And then I go and I fail, and I have to kill my ego.
Well, that's one of the reasons why the training groups are so important. The many you have the Feeling Good Institute, my own free training program at Stanford. I think every therapist needs a place to be able to go once a week for personal refueling, consultation on difficult cases, and learning and role-play practice new therapy skills. And if you have a chance to do that, and you're getting data from every patient every session, your skills will soar and improve. But it won't happen by magic. You've got to put the effort in. And it would be like learning dancing. You could have a manual on how to dance, and you could have an instructor. Well, first you put this step here, and then this step there. So, well, I can do that, I can do that. But integrating together is a beautiful
it's got a process of
dance skill. Yeah, you've got to integrate and practice and work at it.